Hi everyone, Dr. Knackstedt. Let's discuss HMB, which is a breakdown product of leucine, one of the amino acids we've talked a lot about, mainly because of its ability to stimulate protein synthesis. So let's discuss the science behind HMB. So first let's talk about this study. This study looked at HMB in combination with resistance training and looked to see if it increased muscle protein synthesis. And what they found is that it did, but it did so in two specific groups of people: trained individuals who had a really rigorous exercise or untrained individuals. I think that's really relevant, especially for the surgical population, a lot of whom are not regular exercisers. Now, I really, from a surgery standpoint, love this study because what it did is it put people on bed rest and looked at the loss of lean muscle that occurred with bed rest and then how long it took them to get back to their normal activities with or without HMB. And what they found is that HMB decreased the loss of lean muscle mass that happened during bed rest and expedited recovery. That's super exciting because so many surgery patients are either on bed rest or just have decreased activity that leads to loss of lean muscle. Now, here's my whole problem with the HMB studies, similar to my discussion about collagen. So HMB, once again, is a breakdown product of one amino acid. Similar to how collagen is really just a couple amino acids, it's not a complete protein. So while individual studies have shown that HMB or collagen might be effective at, say, increasing muscle protein synthesis or improving skin health, I've never seen a study that compares it head-to-head HMB versus a complete protein, collagen versus a complete protein, and shown that the not complete protein was as effective. So I think it's always better to just take the complete protein, load the boat, get all of the essential amino acids and non-essential amino acids that your body needs in order to heal. Now, patients always ask me, what would you do if you were in my situation? Or what would you do if a family member was in this situation? And I have to say that probably if I had myself or a loved one in a situation, prolonged bed rest, sarcopenia, my recommendation would be prioritize complete protein, and I probably still would try things like HMB or leucine or branched chain amino acids to see if it can augment the protein synthesis. The problem with all of this is it's expensive. So it's a lot of money to buy all these supplements. So I always talk to my patients about prioritizing, and I still have not found a study that wouldn't make me prioritize a complete protein over incomplete options like HMB, leucine, or collagen. If you found a study like that, let me know, DM me, put it in the comments. I'd love to hear it.